Now, let me introduce the folks who will be sharing their expertise and wisdom in alphabetical order. Mitch Daniels is president of Purdue University, which is only his third or fourth career. He was previously governor of Indiana, director of the Office of Management and Budget under President George W. Bush, and before that, he was a CEO. Under his leadership, Purdue has reported a record enrollment this fall. Melissa Marx is an epidemiologist and assistant professor at the Johns Hopkins Bloomberg School of Public Health. As a CDC-trained disease detective, she has responded to many epidemics over the past 2 decades, including SARS, Ebola, and influenza. In addition to supporting the COVID-19 response in the US and in Baltimore, she has led Bloomberg Philanthropies' COVID training project, which funded development and launch of Hopkins' free online contact tracing course. That course enrolled over 1 million learners during the pandemic. Shouan Pan is chancellor of Seattle Colleges, which is a 3-campus system of community colleges in Washington State. He previously served as president of Mesa Community College in Arizona. Like most community colleges, Seattle's suffered a drop in enrollment during the pandemic. But the system has seen some programs, such as the Seattle Promise, which offers financial and wraparound supports, increase enrollment. So he'll be talking about that. Doug Shapiro is the executive director of the National Student Clearinghouse Research Center, which is the nonprofit organization that analyzes student enrollment and degree information from almost all colleges. He produces widely quoted reports on higher education enrollment trends. You've probably written about what his reports in the past. Betty Vandenbosch is Chief Content Officer for Coursera, which is a for-profit online education platform that offers courses, certificates, and degrees from top universities and industry educators. She previously served as chancellor of Purdue University Global, which many of us remember was before that called Kaplan University. In 2020 alone, 30 million youth learners registered on Coursera. I'm going to ask each of them to take a few minutes to discuss how COVID has impacted enrollment at the schools or programs they oversee. But I think we're all keenly concerned about questions of equity. So during our discussions, I hope you'll address what is happening to students from low income or historically disadvantaged backgrounds at your schools or programs. What steps or actions are you working to broaden educational opportunity? So I'm going to start with Dr. Shapiro. Why don't you set the scene by explaining the latest enrollment data?
Sure. Well, thank you. As you probably all know, there were big enrollment declines last year. Maybe not so much in the overall numbers. When we looked at the total undergraduate enrollments last fall, they were down about 5%. That's a lot for higher education. We've almost never seen anything anywhere near that in a single year, typically more like 1.5. But more concerning is that the declines were far more steep within specific areas. And these were largely areas where low income and disadvantaged students concentrate. So community colleges, the declines were twice as large. Freshmen were down by a lot more as well. Makes sense that new students coming in have the most opportunity to kind of take a look at their priorities and think, well, this is a good time to just take a gap or pause. So we saw a 10% decline in freshmen at four-year institutions and a 20% decline at community colleges. And within those numbers, particularly at the community colleges, the declines were far steeper for Black students, Latinx, and Native American students, and surprisingly much steeper for men than for women, and also students from low-income high schools. At four-year public institutions, on the other hand, enrollments held pretty steady overall. They were actually up a tiny bit, 0.2%, thanks entirely to the graduate students. There were increases in graduate students pretty much across the board. But the four-year publics still lost undergraduate students, almost a full percentage point there. They also lost men in particular at about twice that rate, 1.5%, and 8% of their freshman class, smaller than the previous year in 2019. On the plus side, as I mentioned, there were increases in the number of students in the number of graduate students, and that happened pretty much everywhere where grad students, where there were graduate programs, the numbers went up. We also saw increases in primarily online institutions and for-profit institutions, and finally, shorter term programs, such as, say, certificates, generally did better than full degree programs for both undergraduates and for graduate students. So there would have been smaller declines on the undergraduate side for things like certificates, and larger increases on the graduate student side. And the latest data that we have now from the spring term of 2021 is that, well, far from starting to rebound, which many people were hoping for, things got even worse. Largely the same patterns held, but you could pretty much take all of those declines that I just described for fall, add a percentage point more on the downside, and you'd have the spring numbers, which is kind of not surprising if you think about it, given the awful COVID-19 surge that hit last winter. But in terms of the continuing recession, I think there was still a lot of hope that there would be a rebound last spring, particularly in the numbers of adult students and students, including first-time adult students or older students, and older students returning from stop-outs. So students who might have had some college, left to enter the job market. We saw large declines in both of those categories. And this is kind of the no-show recession. In every single recession that we've tracked in the past 30 years, unemployed workers have surged into higher education, mostly community colleges. And they do this to take advantage of lower opportunity costs, to upskill, to gain better credentials for when the job market might improve. And that simply did not happen in this case. In fact, older students declined by just as much as traditional age students. We also started to see a more complete picture this spring in persistence rates. So the numbers, the percent of entering freshmen from fall of 2019, so students who started in the year before the pandemic, they were 2 percentage points less likely to return to school in their second year in the fall of 2020, so in the pandemic, compared to the previous year's freshmen. So again, not just freshmen, but also continuing students were less likely to enroll last fall and this spring. And interestingly, they were also less likely to transfer. A lot of people thought that there would be a lot more transfer activity during the pandemic because of all the disruptions and the need to, say, travel less or stay closer to home. But we saw that this, in our latest report, which came out in the end of August, that the number of students transferring was down dramatically. And that was true along all transfer pathways, including upward transfer from community colleges to four-year institutions, downward transfer, and lateral transfer from one college to another at the same level. And the sole exception there was students transferring upwards from a community college into a highly selective four-year college. So the most academically strong students were somehow able to take advantage of the pain elsewhere in higher education, to perhaps make a leap that might have taken longer without the pandemic, or they might not have made it all otherwise. So that raises some important questions about ultimate graduation and success rates. Again, not just enrollment rates, but ultimate success rates further down the road, both for existing students and for the new incoming freshmen. And for most, and that's because, particularly in the transfer case, those course corrections and adjustments to goals or plans that students typically make when their situations change just became much harder to complete. So the pandemic's pattern of widening existing equity gaps in higher education for these particular types of students at community colleges, low-income students, and students of color, led to declines in access to educational opportunity and also access, the ability to persist and complete. Now, we'll know more next week about the fall of 2021. The National Student Clearinghouse's first numbers on fall enrollments this year are due out on Tuesday. And I'm still optimistic, I have to say, but there are certainly some indicators that have already come out that are not looking good. One of those that's most troubling is that the rates in which students have completed FAFSAs, the applications for federal financial aid, are still much lower than they were last year. And of course, last year they were already lower than the previous year.
Okay, thank you very much. That's a sad but important survey. Okay, let's see. I think we're going to shift over, since you mentioned community colleges feeling the brunt of the decline. Chancellor Pan, can you share some details of what happened to your enrollment and what actions or strategies are bringing students back?
Thank you, Kim. I appreciate Dr. Shapiro's overall analysis of the scene, for sure. Community colleges across the country really bear the brunt of the impact of COVID-19. Seattle College is one of 34 community colleges in the state of Washington. The whole state serves about 340-some thousand students. The whole state suffered enrollment decline, headcount about 17%, FTE 11%. For Seattle colleges, we actually had a double whammy, if you will. Not only in addition to pandemic impact, we went through statewide ERP transition from the old legacy system to a new PeopleSoft program that took a lot of energy. Fortunately, we have some good spots as well as we suffered impact. So our enrollment declined about 10% between 2019 and 2021. Before the pandemic, this Seattle College as a district done a lot of work in terms of integration, IT, HR, web services, foundation, that really help us to be more resourceful, to be more agile in responding to the particular challenges by pandemic. Nevertheless, we did suffer enrollment increase. As also Mr. Shapiro mentioned, Seattle College is similar to many community colleges. We serve over 44% of first generation students of low income, students of color. So we really try to focus, how can we lessen the impact of this pandemic to this student population? We continue to look at a program called, Kim, you mentioned the Seattle Promise. It's a collaboration between the city, Seattle Public Schools, Seattle colleges. Just from 2019, we had about 380 students, but last fall, 2020, that almost tripled. 850 students. This fall, the numbers we're approaching 1,000 students. And Doug mentioned a financial aid application. We really focus to reach out to this population, working with Seattle Public Schools. The student who applied this fall had a 95% of financial aid completion. That's because our recruitment folks really worked with the Seattle Public School counselors, faculty, to reach out to these students, encourage them to complete a financial aid. So Seattle Promise program, it's a last dollar tuition kind of a system. Tuition is most students are taken care of. They apply to financial aid. The gap between the real cost and awarded amount is covered. But for lower students, by the way, 62% of the students in Promise program are students of color. About 60% of the students, 25% of them, their family makes less than $25,000 a year in Seattle. Another 40 some percent, if you add together, total 60%, their family income makes less than $75,000. So for those students, Seattle Promise program provide what we call equity scholarship. We provide them additional dollars from the levy from the city. They get $500 per quarter. But leveraging the COVID relief funds, the HERF funds, we double that amount. So each student who meet the income level receives $1,000. In addition, for all 3 quarters, in addition, our foundation really kicked into gear. We started a campaign called Equity Can't Wait to collaborate with our foundation, with our business partners, individuals who care about the equity issues in Seattle, raised a lot of emergency funds. Those also went out to support the student. In addition, we're thinking, how do we, as we transition to virtual provision instruction, how do we send the words out? Seattle College is still open, we're here for you. So we started called Seattle Discovery. It's really rediscover. In 2 weeks, we reached out to almost invited 12,000 students. In 2 weeks, virtual environment, 75 some faculty staff online, just answer all kinds of questions. It really helped students to realize Seattle College is here for you. We're able to support your needs. So this provide tuition to students is only one part of the solution. It's really the wrap-around services. We have, fortunately with the funding, we have retention specialists who follow students, making sure financial aid is completed. Your assignments, you have textbooks, you have personal difficulties. How do we help you? Making sure internal resources, community resources are connected for those students. So that kind of almost case management, one-to-one wraparound service. Looking at our completion persistent rate, we're very pleased to see they are in the high 80% from quarter to quarter. And for, again, 60% of the student and 37% of the student actually are first generation in this new cohort. So in the meantime, we also worked closely with our local industry, started 5 micro-credential programs. These are short-term, specifically targeting displaced by the COVID-19. We started these programs in residential construction, cloud computing, health IT, project management. So we are looking about almost 70 students. 70% of the 70 students we're serving today are the real target students. They are LGBT students. They are students of color. They are low income. So these are some of the bright spots in a very dark period of time.
Yeah.
I think community college presidents across the country are worried about the generation of students, males in particular. What do we do to help them back to school? So that's the challenge ahead of us.
Yeah, that's great. And the wraparound issue is so important. Let's see, on the good news section, we look at a school like Purdue University. Flagship public universities especially appear to have maintained their enrollment during the pandemic, but Purdue has, gone up. It's not just maintaining, it's actually setting new records. President Daniels, can you talk about why you think you've seen an actual increase in enrollment, and who are the students who are enrolling?
Kim, we were taken by surprise. Not that we grew, because that's been an annual event here for some time. We're about 30% larger than we were in 2013. But this year's jump really did surprise us, and I guess doubly so since it came in during such a difficult period. The surprise are previously, to me, astonishingly accurate models, enrollment models, which actually were correct for in-state students and for international students, missed by over 300 basis points, a huge miss in terms of the other 49 states. And we were flooded with acceptances of our offer that we didn't expect. So we have a record number of undergrads and a record number of graduate students. So therefore the total is close to 50,000 on our main campus. I should add that our two regional campuses, in the pattern that I know is concerning to us all, like the community colleges of our state, are having a much tougher time. But here at Purdue West Lafayette, we were scrambling really to make sure we had enough classroom space, enough residential space, happy problems. And we recognize how fortunate we are. In terms of why, we survey, of course, those students who come and try to understand what led to their decision. The top three factors, two are now very familiar. One is a good reputation for academic quality. The second is affordability. Some may know that we have not changed tuition or fees here since 2012, and have actually lowered the cost of room, board, and books. So every year this shows up as a decision factor for students who come here. We're very fixed on affordability and accessibility, and that continues, I think, to contribute. But to the main topic here, it became very clear that the pandemic and the fact that we were here and operating, as far as we know, we were more open as any school our size. Throughout the last year, we had 90% of our students were on campus, and half of the remainder were basically internationals who couldn't get here. So almost every student, although we had an online option, almost every student did come back. And it wasn't life as normal, but it was closer to it, I guess, than in most other places. 70+% of our courses were either fully or partially in person. I don't want to minimize what an incredible collective effort it took. In fact, it was probably the greatest, most, looking back, fulfilling collective implementation endeavor I can remember being a part of. But leaving how we did it aside, I'll just say the results clearly showed up. When we asked students why they chose Purdue, high percentage mentioned the fact that they felt more confident, that they have a full residential experience if they came here. One thing I hadn't thought about, but it only makes sense, we gave tours. And as I read the verbatims of these surveys, many students mentioned the fact that other schools they were interested in were all locked down. And in many cases, they wouldn't even let them on campus to look. And so this was probably an advantage we hadn't contemplated. But in any event, don't know that we don't necessarily expect it to be replicated next year. We're going to be careful, however, about the decisions we make, just to make sure we're not overwhelmed again. I'll just say one other thing. I know that you are interested in, we all are, in the issues of access and for various populations. We're doing everything we know how, but the only one I'll single out is we have started 3 high schools of our own in inner city neighborhoods, from which we were getting almost no students. And we had our first graduating class this year. It raised by 250% the number of students from that entire school district, Indianapolis, that we'd been recruiting. Next year, we'll top 1,000 students total in those 3 schools. So it was an extreme measure, but one we felt we needed to take. We just needed to do some things that were different and additive. And so we have high hopes for that, looking ahead.
Oh, okay, great. Yeah, thank you. I wasn't aware of the high school project. That sounds interesting. I don't know if we have reporters from that area looking at that, but that sounds very interesting. Okay, let's see. We've talked to the folks from the traditional colleges, but Hopkins launched a sort of a micro course on Coursera that Dr. Marx can tell us about. Can you talk about that for a minute?
I'd be happy to. So this was a contact tracing course, and we were thrilled at the enthusiasm that the creation and the launching of this course produced. We had over 3.6 million unique visitors to the course, and we had over 1 million, 1.3 million at last look, people enrolled in the course, and over 700,000 people, that's more than half of those enrolled, completing the course. This is as of yesterday. And I just want to take a second to tell you a little bit about the course and why I think that it created this kind of buzz. Well, first of all, it was a contact tracing course. It was a course that included some basics about COVID, the virology, transmission, and gave people who took the course a real sort of crash course in what this virus was and how it was moving about in populations. And then it took a very practical approach to teaching people how to be a contact tracer, and including videos and interactive mock sessions between mock actor, patients, and contact tracers. And this course came out at the exact right time. We in the US and globally needed contact tracers, and we needed them quickly, and there was no course like this out there. And so it was filling a niche. It filled this gap for contact tracers, but it also filled another gap that I don't think that when the course was developed, this was sort of the main motivation for developing the course. I think we really wanted to get contact tracers trained and out there ready to help with the pandemic. But the other thing that I think that it did was it gave people who were feeling helpless and scared about the epidemic. So it came out in May of 2020. It gave people a way to increase their knowledge and to reduce anxiety about the virus and transmission. And we heard from a variety of people taking the course. Some people wanted to become a contact tracer, but some people just wanted knowledge about COVID, and they wanted to understand the science. So as far as who was enrolling in the class, we have data from the Coursera platform that talks about all of the learners. And then we did a survey of about 3% of the people who took the course participated in the survey. That sounds like a low number, but it was 33,000 people took a survey that we put out there for them. And then we did a qualitative survey where we called a subset of people who agreed to be called and asked them more questions about what they liked, what they didn't like, and what they wanted to get out of the course. So I'll tell you a little bit about what we found across these 3 modes of evaluating the course. So first of all, I know there's a question about equity in reaching disadvantaged populations. Kim mentioned it, but I just want to reiterate that this was an entirely free course. It was made possible by a grant from Bloomberg Philanthropies. And this is not the only course that we put out. It was just the most popular. We put out other courses for more niche audiences, like people working in congregate settings around COVID. And people who were designing and evaluating contact tracing programs, to name just a few. But for this course, we found that a lot of the people taking the course were employed full-time, more than 50%. There were about 20% that were unemployed and looking, and some of those people were thinking that contact tracing could be a job for them. As far as their education, we designed this course for contact tracers. And so it wasn't that we designed it for people with, college degree or master's degree or high school degree. We made it so that we thought that people who would be good contact tracers could complete the course. So we did find that about 30% of the people who took the course had less than a college degree. We had more people taking the course who were 18 to 24-year-olds than Coursera normally has enroll in their courses, which was good. We also had, Coursera, you'll hear more about Coursera in general, but Coursera is used by adult learners, and really the 25-year-olds to 35-year-olds are the ones that take it the most. And we did find that our course was taken by a lot of that age group, but we also had more people in this 25 to 34-year-old, 18 to 24-year-old age group. And we also had a little bit more in the older age groups than other Coursera courses. There were about equal proportion of males and females. And then coming to why people took the course, looking at this subset of 33,000 people, more than half said they took the course because of personal interest, but we knew at the time that contact tracing programs in particular states in the US were going to require this course to become a contact tracer. So we know that several states, and over time we learned that more and more states were requiring the course, and people thought they would have a better chance of getting the job if they'd already taken the course, or if they hadn't taken it and they did get a job, they were asked to take the course. About 39% of the people we surveyed were taking it, 39 plus 23. So almost 60% of people taking the course either were taking it to become qualified or taking it after they'd gotten a job. We know that some places in Maryland State, the entire New York State, some parts of Washington, Oregon, California, Rhode Island, North Carolina, Puerto Rico, Dallas, Fort Worth, all of them required this training as part of their contact tracing onboarding. And we also heard that the US Navy, the embassy, and the US Embassy in the Philippines, the US Coast Guard, they use this training as part of their essential training. I have a list of countries globally that used it as well. And we were thrilled also to be able to offer this content in something called a Creative Commons license, where the content was made available on request to be adapted to particular settings where they were needed. So that's why I think it was so well taken up by these entities that needed to train people to be contact tracers quite quickly. Everywhere from Brazil, Yemen, UAE, Greece, Canada, Bahamas, they took it up as a core part of their training. I'm just going to talk about now briefly. We had about, of the people who took our survey and were US residents, about 14% were working as a contact tracer or were just about to start working as a contact tracer. So in a lot of ways, it was a successful way for them to enter the contact tracing world. Did not guarantee them a job, of course. We had almost 7,000 people comment on the Learner Stories page of Coursera, just expressing their gratitude for setting them up for a career as a contact tracer, but also just for giving them enough information to feel like they really understood what was going on with the pandemic. And maybe I'll say one more thing, and then I'll turn it over. We had all these stories, and I don't have time to tell you all of them, but I'll just recount one story that was put out in a local newspaper. There was a mother of a Johns Hopkins School of Public Health student who lived in a senior housing community in Florida, who took the course because she was interested in it and her daughter told her about it. And then there were cases in her community and nobody came out to do contact tracing or advise people about isolation and quarantine. And so she did it. She took it upon herself to do to advise people on isolation and quarantine. And then more cases came, and I guess the county just wasn't ramped up enough to respond quickly. And she got 4 or 5 of her friends and colleagues to take the course as well. And they became the de facto facility contact tracing team. I mean, we think that the counties and the government should be playing that role, but what a nice thing that they were able to serve their community in that way. So be happy to answer more questions about this course, but we're thrilled with the collaboration with Coursera and with Bloomberg Philanthropies, and we're happy that the course could serve an important need at an important time.
Great, thank you. Thank you very much. Betty, can you talk a little bit about what other courses pandemic lockdown people were interested in, and who got access to those kind of educational opportunities?
I'd be delighted to, thank you. Our most popular course during the pandemic was The Science and Wellbeing by Laurie Santos at Yale University. More than 3.7 million people have taken that course, not all of them during the pandemic, but most of them. And it just shows what people were fussing about during the pandemic. But what's really exciting to us about that is more than half of the people who completed that course went on to take other courses. So people use the pandemic to learn. And of course, as an educator, learning is the most important thing to me. And I think that it really helped folks in some unexpected ways. Another group of folks who took advantage of the pandemic were folks who took entry-level certificates. Now, everybody knows that the pandemic was devastating to many industries, and many, many people lost their jobs. Many of them were not high earners. And so on Coursera, we have a series of 14 entry-level certificates where folks can take the coursework and over the period of 1 to 6 months can learn what they need for an entry-level job in a digital career. So just imagine someone has been in retail or has been in hospitality. They know they've got to make a change. They know that something has to happen. And in less than half a year, for many of them, it was only a month or two, they've got the skills and capabilities they need for an entry-level position. And we know that this is the case because we have a job board and we have employers on that job board who are interested in these learners. But there's even more than that. These programs are programs that some of our universities take in as articulatable credit. So for example, the Google IT certificate from Google and Coursera teaches people entry-level skills in IT. They can be a help desk leader or something like that. So someone who's made $30,000 can now get a $50,000 job. And they can then articulate that credit into the Bachelor's of Science in Computer Science at the University of London, which is also on the Coursera platform. Fully 36% of the folks who are in the University of London degree started with the Google IT certificate. And that really, for me, tells the story of the pandemic. You start with a little bit, perhaps with the science of well-being. Then you take something that gets you a better job, that gets you going, that changes the trajectory of your life. And frankly, for some of these folks, the life of their families. And then with that, you've developed confidence. You know what you can do, and you're ready. You move on to a bachelor's degree in computer science. And you know, this isn't just for folks who just have a high school education, although they're perfectly capable. Some people have a degree that they can't get a job in. We've got one example of a guy who had a degree in the social sciences, moved over, and now he's in the University of London, Bachelor of Science in Computer Science. For me, that is the exciting part about what happened during the pandemic. And I'd just like to add one more thing. I'd like to thank all of our university and industry partners, because during the pandemic, they allowed us to offer all of the courses, just about all, I can't say all, just about all of the courses on Coursera for free to any university around the world. More than 4,000 universities took advantage of that opportunity, and more than 2.3 million students enrolled in more than 19 million courses. That all happened because our partners and we thought we have to do something here. Folks aren't ready and they have to keep learning. So those are some of the bright spots from the pandemic.
Okay, that's great. That's so interesting. I know we have a limited amount of time and I have lots of questions for myself, but I see we have one question from so far from one of our members of the audience, and it's for President Daniels to say, you did make an effort to keep your campus open during the pandemic, and there were concerns at that time that that would spread the disease more. So I wondered if you could talk about how you made that calculus and what impact your decision had on the COVID spread during that time.
Made the decision because based on the evidence, which we knew was only partial at the time we had to decide it, that it was responsible. It was more responsible to try to be open, not interrupt, as too many other places did, the education of our students, and that it was incumbent on us to do everything possible to make the campus safe. We did. We had cases, but we had and it was an enormous undertaking to be able not only to provide safe quarantine for people as they recovered from the virus, but also we had to build from scratch. We built the whole health system from scratch. We don't have a medical school. We also had to build an academic advising function that hadn't been there before. So a student who had to go into quarantine that we provided, like running a big hotel, honestly, had a medical case advisor and an academic advisor. We were able to switch these students to the online mode for the 10 days to 2 weeks until they could go back to class normally. But on a 1 to 6 severity scale that we set up, virtually no cases ever progressed past the third level. So it was asymptomatic, 1 symptom, 2 symptoms, 6 candidate for hospitalization. So that was something we kept an eye on. Listen, if we had ever seen a significant number of people getting truly ill, we'd have stopped and admitted it just, that our best efforts weren't enough. But looking back, with enormous gratitude to all my coworkers who made this possible, we believe and I can promise you overwhelmingly, our students and their families believe that we did the right thing, that they were so much better off than all their friends elsewhere. I hear this every day from students here. And then, as we discussed earlier, this wasn't in our minds at the time, but it apparently had something to do with the attractiveness of our university this year, as many students, observed what went on here. So honest people can differ. We understood completely those who made other choices, but mercifully, the one we made, I believe it's fair to say, worked out very well.
Great. All right. Thank you very much. You know, a couple of you have talked about how micro-credentials can also be viewed as an improvement for equity and access in higher education. I wondered if any of you would like to talk about how micro-credentials can be used to improve equity and access and how they are being used. And I know, let's see, Chancellor Pond, do you want to talk about that a little bit?
Yeah, so we worked with a lab called Educational Design Lab. It's a community college growth engine fund. It's really trying to break the traditional mold, only credit, seats online, and all of that. It's trying to really merge the credit and non-credit side. So it tends to be shorter, but it's a stackable. So in fact, the short credits they accumulated, at Seattle College, we also have 13 bachelor degree, BAS, applied science. So many of these students accumulate credits, stackable, they can articulate to the credit side. Again, our experience this past year working with, in fact, hospitals, residential construction company actually supported scholarships. Many of the 70 students I mentioned earlier actually got scholarship from the industry to support them. So I think this is something new for us. I know many colleges across the country are looking at just merge this credential, credit and non-credit side. And again, when we look at who are the students that responded to our 70% of them are the students of color, displaced. I think we're doing the right thing. We're taking notes, we're tracking the student progression, how many of be able to get back on job or complete with bachelor degree.
Okay, great. All right, let's see. I guess we have a question from the staff. Melissa, can you just confirm the number of people who took the contact tracing course and the number who finished? Can you remind us?
Yes, I can. The number of people who enrolled in the course were 1.3 million, and the number who completed the course were over 700,000.
Yeah, and do you happen to, or maybe Betty can share, what is the average completion rate for a typical Mooc?
So we don't have that number because completion is something that doesn't really fit in the Mooc world. When somebody goes in, they might decide that they don't want to do the assessments, that they don't want a certificate of completion. That's fine. Maybe they're exploring to see what they'd like to do next. They might try 5 or 6 different things. So it's really important for us, impossible for us to say how many finished who started. However, we're really proud of the work that Johns Hopkins did and are really excited by the results that they achieved.
Well, I know I've done some research on this subject. There's a woman named Katie Porter who did a study that found that 15% of starters completed Moocs. Does that sound about right, Betty? Or
yeah, that wouldn't surprise me if that it was that number.
Mm-hmm. And I think some other studies have found lower, some maybe a little higher, but
now it's really interesting. One thing that I am very able to talk about is folks in our degree programs. Mm-hmm. People often say that people who take online degrees do not retain as well. They don't persist as well as folks who take programs, face to face. And that has not been our experience. Folks who are in our degree programs are persisting at exactly the same rate as they do on the campuses. Mm-hmm. So it depends on what you're learning.
Mm-hmm. Let's see, the president of Purdue can talk about. Purdue certainly has a big online program. Can you talk about what impact you saw on enrollment during COVID, President Daniels?
Yes, well, we're active in two ways, but I think the one you are asking about is Purdue Global, which is our online program for adult learners almost entirely. And as I think Dr. Shapiro mentioned earlier, there didn't appear to be the general surge that has sometimes been associated with bad economies. So we grew and we outgrew the market a little bit, but the market wasn't growing at the rate that one might have expected looking historically. But the it's a mission we're very proud of. I often describe it as the next concentric ring in our land grant mission to constantly modernize and expand out the range of people to whom we are trying to bring higher ed, and it's growing. We also have off our other campuses online programs at the moment. They're growing very fast. These are primarily master's degrees and in some cases micro credentials of the kind you mentioned. Someone who wants to touch up their aeronautical engineering skills or something. But we think that the future is a very bright and important one for at least for our institution in both those realms.
Okay, we don't have very much more time, so I'd like to ask each of you to discuss, maybe just before as a wrap up, your concerns about or what your ideas might be, let's say, to address the huge decline we've seen in enrollment by students of color, low-income students, disadvantaged students. I mean, COVID has definitely taken a hit, given a hit to that population. What should be done or can be done? And I guess I'll start with Betty. Any thoughts about what Coursera can do, and then we can toss it to somebody else.
So one thing that the entry-level certificates I talked about earlier are places where folks of color, folks who haven't had the number of opportunities go. The people who take those courses, nearly 60% of them are underrepresented minorities, they're veterans, they're women, and so forth. So there is a real important opportunity to make sure that it's a small piece. Now, the other thing that I think is really important, and this is something that is borne out over and over again, is that once learners develop confidence, once they develop self-efficacy and they know they can do it, problems go away. In the early days, however, it's really important to support them and surround them. And that's exactly what we do in our entry-level certificates. Goodwill, Merit America, and other organizations like that support students in our programs when they need that support to help them get going. And really, that's what's necessary. We've got to accept where they're starting from and help them get going till they develop the confidence to get going on their own. And it works.
Okay, great. Chancellor Penn, you talked about wraparound services. Is that the key to improving, bringing people back into higher education who might feel it's not for them, or they?
For sure, wraparound service, what we learned from Seattle Promise, we're trying hard, use that, what we learned towards the larger student population. But it's very intensive. We can do it for all students. Mm-hmm. The other thing that community college, at least in Seattle, we have to really try to ask ourselves, are we asking the student to be ready for us, or are we refigure our instruction, our support services ready for students? You know what I mean? I think that's a mindset change. We got to get our system ready for students regardless who they are. Mm-hmm. Financial aid issues. We have our own bureaucratic system. Some at the state level, some at federal level. Financial aid application is still very, very difficult. They hurt underserved population, immigrants. We can look at the rate and who complete financial aid. No, there are a lot of bureaucratic system. We got to just break through. So these are all things we're considering.
Okay, and President Daniels, you're addressing the pipeline problem by starting your own high schools. Is there anything else you want to say about what needs to be done to bring people back into higher education?
No magic answers, but yes, I mean, in our case, it's keep costs down, special effort on student success, because what matters is not how many we bring in, it's how many we send out. And then, of course, the extreme measures or unusual measures, the high school being the best example, but not the only one I could give you. The only other thing I would want to say, Kim, is that I'm really troubled. This is a much broader issue than that. There's been a 10% drop in our state, and I now know that that's not too dissimilar from national numbers in the percentage of a stagnant 18-year-old pool or a high school graduation universe. 10% drop in those who say they're going to college, and it's not confined at all to the populations we're talking about. And so it's a more pervasive issue, and we've all got to go to work on it.
Okay, well, I would love to hear more from Doug and Melissa, but we're running out of time, and I promised President Daniels we would end on time. So let's see, I do want to say that apparently the National Student Clearinghouse will be coming out with new data. So those of you who are interested in what's going on should tune back in. I'm sure that they'll distribute their report in the normal way, so please watch. Thank you, everybody, and tune in about a half an hour to hear from reporters who've covered student debt issues if you want to get some story ideas and so on. Anyway, I promise we'd end on time, so we are ending on time. Thank you, everybody.
Thank you.
Bye.
Thank you very much.